So let's talk about these cases, about the Seffihair and even the combination with other therapy, like, as I told you, carboxytherapy or injection of polydesoxyribonucleotides too. This is a male, 42 years, with androgenetic alopecia, and we performed one Seffihair and then carboxytherapy, 5 sections every 7 days. As I told you before, I performed the first section of carboxytherapy during the Seffihair treatment. So in the 10 minutes that I wait, the centrifugation of the tissues. And then, because I want to prepare the tissue and to receive our stromal vascular fractions. And this is the first of the cases. This is the second one, same thing. One Seffihair and carboxytherapy, 5 sections every 7 days. This is a little bit at risky cases because it's moderate to severe androgenetic alopecia. This is not the perfect indication, but the results was, I didn't expect this kind of results, but just with one Seffihair and 5 sections of carboxytherapy every 7 days, we obtained increasing in thickness of the hair, as you can see. Obviously, the frontal area, when we don't have miniaturizing follicles, but we don't have for more follicle, with the Seffihair, we cannot do nothing, neither with carboxytherapy or polydesoxyribonucleotides. But as you can see, the situation of the entire scalp, except from the frontal area, it was very good results after. This one is one case, and I want to present even with the combination of PRP. This is alone one of the cases that I performed the first Seffihair with my 5 section of carboxytherapy every 7 days. And this is before and after Seffihair and carboxytherapy. So this is after 3 sections of PRP, 1 each month. This is a 37-year-old man, and we know that this is typically androgenetic alopecia. We are in the moderate grade. This is a woman with classic androgenetic alopecia. We performed 1 Seffihair and carboxytherapy, 5 sections every 7 days, and mesotherapy with PDRN, 6 sections every 14 days. I were expecting more results in these patients, but now we are starting to renew new protocol, and I want to repeat exactly the same protocol, but I want to mix, because in this first pre and post picture treat the polynucleotides in the same sections of Seffihair, but after the cycle of carboxytherapy. This is one case of our colleague Domenico Piccolo that used a trichobiolite technique combining with the Seffihair. This is a young man with androgenetic alopecia, and he performed 1 Seffihair and trichobiolite that it consists in the association of mesotherapy and photobiomodulation LED, and this is the status of 3 to 6 sections that he has in the protocol to perform until 6. This is the response after the Seffihair and 3 sections of trichobiolites, 1 each month. This is a kind of technology that is not yet available. I think in a few months they could be available, this kind of LED technique associated with the mesotherapy, that it's just a normal medical device that we can find on the market with for the hair. That it's a mix with antioxidant, biotin, and vitamins. This is a young man with alopecia areata, not responsive to steroids. This is another interesting case of Domenico Piccolo, because he performed just 1 Seffihair and 2 protocol of 6 sections, each one of trichobiolites. This is another young man with androgenetic alopecia, and this is the images of trichoscopy after 1 Seffihair and 6 sections of trichobiolite every month. Usually we use the lead therapy every week, even 2 times per week, but this kind of procedure, I cannot know nothing about it yet, because he has to publishing this kind of technique and this kind of devices. But he performed just 1 sections, mixed mesotherapy and photobiomodulation every month. Same thing, female androgenetic alopecia, 1 Seffihair and trichobiolites, 4 sections every month. Same thing with 6 trichobiolites treatments. This is a really amazing case. A very young man, 16 years old, with androgenetic alopecia. And he performed even 1 Seffihair, and the first protocol of after 6 sections of trichobiolites monthly, you can see in the second picture in the middle. And then after 9 trichobiolite sections in the third pictures. Same thing here, young woman, scarring alopecia. And he performed 1 Seffihair and 6 trichobiolites technique. Same of lichen planus pilaris with subsequent scarring alopecia. We talked about this kind of disease, and we have to wait to inject our regenerative therapy that the disease is it's not in acute phase. But then we can perform it with our regenerative therapy. Same too, this is a severe androgenetic alopecia with 1 Seffihair and 6 trichobiolite sections. And then I want to show you and talk about our transplant, the importance of the Seffihair in transplant. So, how regenerative medicine, and specifically Seffihair, may improve the biological environment of hair transplantation. So not only from an aesthetic perspective, but from a tissue biology perspective. So hair transplantation has changed dramatically over the last years. So as you can see, the number of procedures worldwide increased from around 350,000 to more than 3 million. What does it mean? It means that this creates a completely new category of patients, hair transplanted patients. Hair transplanted patients we can divide in 3 subtypes. First one is the young or older patients that have a healthy scalp. So good tissue quality, stable alopecia, and who can directly access to a transplantation, even without regenerative medicine, because we know they can respond good to the transplant. The second category is that the patients with a simple scalp condition, for example, the seborrheic dermatitis or chronic inflammation conditions, requiring preliminary medical treatments like regenerative, just for mediate the inflammatory background that we have underground this kind of disease. And then the third category, that is the best for indication with regenerative medicine before to perform the hair transplantation, it's the adult patients with failed transplant before, or they cannot respond to conventional therapy, or they have a sign of chronic tissue damages. There are scarring tissues, and this is the main target of combination between the regenerative medicine and the hair transplantation. We want we have the increasing of secondary procedure now in the transplantation. That's why I talk about how the numbers are increasing. That's why we are more frequently in front of patients that there are second, third transplantation. So in the traditional surgical approach, obviously, we simply move follicles from one area to another area of the scalp. Regenerative medicine introduced a different concept. So before moving follicles, we want to improve the biological competence of the recipient tissue. So the central idea it's simple, because a healthy scalp can support the transplantation of the follicles. But if we have poor biology, if we have inflammation, fibrosis, vascular insufficiency, and aged signaling altering, the follicle may survive, but often with poorer quality. So we perform one transplant, and then the first follicle cycle is perfect, but then the second one, it's poorer in quality. So that's why don't perform before our regenerative medicine that can do the maximum of the results of the transplantation. So a Seffihair treatment performed a few months before surgery, about 3 months before, can improve the tissue's responsiveness to conventional therapies too, creating an optimal therapeutical window. In other words, the regenerative therapy can increase the biological space available for molecular exchanging between the tissue and the follicle. So we can improve the communication between the cells because we are curing the microenvironment. So why adipose tissues matters? Because for the extracellular matrix remodeling, for the improvement of vascular components, modulation of inflammation, absolutely most important target of regenerative medicine, metabolic support for the tissues, increase trophic quality of the recipient area. So the interaction between adipose tissues and follicle may partially explain why tissue quality matters so much when we talk about this kind of patient. So one of the most important modern concept is that the follicle is not an isolated structure. Like until a few years ago, we think about it, just think only on the follicle, and that's it. But we know how important it is, and we talk about it from this morning, the microenvironment. It's an ecosystem, and we have to cure all the part of this system. So regenerative medicine, it's not simply adding a cells. It's about modifying the biological dialogue of the tissue. But we have, when we talk about the transplant, we have to evaluate it not only if the follicle goes back or not, but we also care about how it regrows. Because the goal of modern hair restoration surgery is to obtain the follicle with the same caliber, same quality, same stability over time. That's why for this to happen, the follicle must graft into biological competent tissues. That's the important to recreate this kind of tissue. But even because the follicle cells are very highly proliferative cells and have a very high energy requirement. That's why a booster of regenerative medicine in these cases, it's very, very important. So the objective is to harvest and re-injected microfragmented adipose tissues with minimal manipulation, maintaining regenerative cellular components and biological signaling. What about two different protocols? So inject infranatant protocol with centrifugation and without. The pros are that the grafting phase is faster and painless, as we can see today. This makes the patients more compliant, for sure. The cons are that the tissue is slightly impoverished through centrifugation. But we have a publication that shows us that the liquid part of stromal vascular fraction contains usually the important, powerful of regeneration. This one, it's when we talk about a normal androgenetic alopecia. But when we talk about this reference of patients, so transplanted patients, it could be a different rule because the injection of wall tissues could be very, very interesting approach. So when it's suggested just injection of infranatant protocol for first treatment, for sure, in order to make it easier for the patients to accept the little bit discomfort when they will have seen the first results too. What about the wall tissue protocol? The pros is that I have in total tissue is richer, therefore more powerful, for sure. The tissue, the concept is that the tissue is injected with a 27 gauge needle, and sometimes even with the 27 gauge, you can have the clots inside. Therefore, the treatment is more painful and has a longer duration. But so, after today, we know, thanks to Alan, to perform our anesthesia, and it's very simple, in simple way, we can choose to perform even this kind of protocol when it is suggested after the first treatment, or when the patient is not so young. So presumably their tissues is less rich than younger patients. That's why we don't want to waste material. For this protocol, it's sufficient to extract 7-8 milliliters of adipose tissues. As I told you before, during the practice, 40 passages within the syringes to obtain a super nanofat. And then I recommend to add 3-4 ml of hyaluronic acid or hair booster, the implant. Can lead you the material more fluid and more easily to inject. This is a kind of technique that mixed both technique. This is our Dr. Piero Tesauro called stem and vol concept. So the stem part and the volume part. The stem part, we know, it's the liquid regenerative components. The volume part, it's a microfragmented volumetric component. So the nanofat, ultra nanofats that I told you before after the 40 passages. If we have scarring tissues and we want to do a support to these tissues, the combination of these two techniques is the goal, because you can inject, you can divide your harvesting tissues in two different parts. One part you can inject wall tissue without centrifugation in the deepest plane to create a support of our scalp. And the second part, after centrifugation, we can do our pure regenerative, as we can inject today with our 4 mm needles and with all the scalp to give the booster of the regenerative. But we are talking about approximately, we thought, milliliters, but how much? So we quantified the two different protocols. That's the necessary, the stem part, 0.3 to 0.5 ml per centimeter square, and for vol, 0.2 to 0.4 per centimeter square. And it's the objective of this kind of therapy, because we want to, so the reconstructive cases are extremely useful because they make the biology problem visible. In scar tissues, differences in recipient area quality become much easier to observe. That's why if we have a scarring area, we see it, and we need to do something to prepare that tissue to receive the transplant. And I show you some clinical cases, very, very interesting cases. This patient lived most of his life with a visible scar from accident at age 4, burning. After multiple surgery, including skin expansions and scalp procedures, he completed its initial surgical journey at 20, resulting in the appearance that's shown in the left picture. So 20 years later, thanks to a simple, less invasive technique, he found the courage to resume his scalp reconstruction, leading to outcome seen in the right photograph. After one Seffihair, and after 3 months, one Seffihair with stem and voll technique, so the both technique, after 3 months, the hair transplant. This is another important case, is the negative outcomes at normal therapy. We see the first one, the pictures in the middle is after the Seffihair, and the third one is after the transplantation. This is this view, and you can see on the back, the improvements are really amazing. This is another important cases of scarring alopecia post-radiotherapy cases. It starts from February 2020. In November 2020, the situation was that one that you see in the second pictures after 2 Seffihair procedures. Then in January 2021, she performed the full transplantation. And then you can see at March 2021 and May 2021 how the situation is. So 2 treatments of Seffihair, stem and voll technique, plus transplantation. This is another interesting case of scarring alopecia post-radiotherapy cases. And is radiotherapy sections. And one treatment of Seffihair, stem and voll technique, plus transplantation. And this is a case of 33 years old patients. After 3 Seffihair sections performed with Alessandro Gennai, he underwent a transplantation of 2,500 follicular unit in the frontal area. As you can see from the comparison, the results, it's really significant. This experience once again shown us the importance of preparing the ground, which improves the graft's ability to take hold and provides a better response to a traditional low responders therapies. So in my opinion, these are currently the best indication for Seffihair associated even with the transplantation. So over 50, the poor responders of conventional therapy, scarred scalp, reconstructive cases, depleted scalp, and failed progressive transplantation. So the objective is no longer simply to obtain a regrowth, but we want to obtain a stable, high-quality regrowth over time inside a biological competent tissue. So hair transplantation is progressively becoming a biological procedure because we have to think about it, because we have to think not only on the follicles, but with all the macro environment that we have. And thank you very much for your attention.